Well, Olive, when President William Ruto took office, he promised to address the issues plaguing the health sector. He further promised to improve access to healthcare, increase the health workforce by employing at least 20,000 health workers, as well as improving access to healthcare. 1 year down the line, doctors are once again threatening industrial action due to poor working conditions, as public hospitals lack infrastructure needed, as well as shortage of medication.
Health insurance is critical in the access of quality healthcare, and according to the Kenya Demographic Health Survey, 1 in 4 persons in Kenya has some form of health insurance, while the National Hospital Insurance Fund is the most common type of health insurance, meaning for Kenyans who do not have a comprehensive health cover, they are forced to dig deeper into their pockets for treatment when they fall ill. Now, as Kenya plans to roll out universal health coverage for the 4th time, will Kenya get it right this time?
We still have many county-based contracts. We have the universal coverage contracts. We have some they call professional casual contracts, and we have those on PNP, earning different salaries. Yet these people are in the same rota, doing the same work, seeing the same patients for the same number of hours. So that promise of harmonizing to ensure that equal pay for equal work.
The Kenya Kwanza administration promised to employ 20,000 healthcare workers and involve healthcare stakeholders in agenda setting.
The government of Kenya Kwanza really knew the gaps that existed at the time of campaign. And that's why they give an absolute number of health workers that ought to be employed within 100 days. And see if failure to have this number, 20,000 employed within 100 days, and within a year, means that there's something that is missing.
To ease the burden on the public health system, the president promised to invest heavily in primary healthcare and employ 100,000 community health promoters to provide healthcare for all Kenyans.
That as you bring the health promoters on board, which is a very good thing, there must be a commensurate staffing improvement for the mainstream healthcare workers, and especially the healthcare workers who are working at the primary healthcare.
The issues that we're demanding to be sorted out are very clear. Number one of them was the basic salary, the basic salary component of the CBA that was signed in 2017. We talked about the unemployment, the health workforce, which actually will even help them drive the agenda of the UHC. Must be sorry, the petition we gave out yesterday. We talked about the new collective bargaining agreement, which was a right in the Constitution. So these issues that we had presented for last year, and again part of this year, and there's been discussions on them. If they're not resolved, I am not threatening, but it's a reality that we will go on strike. Yes, and the notice probably will come in November.
The tussle between the county governments and the Ministry of Health has been ongoing, with the governors asking the Ministry of Health to desist from reclaiming the health functions. The reforms at the National Health Insurance Fund and the Kenya Medical Supplies Agency seem to be a step in the right direction in a bid to achieve universal health coverage. But scandals and cartels have dominated the institutions, with the latest being the botched 3.7 billion shilling mosquito net tender at KEMSA.
I want to give you my commitment. I will clean up cancer. Whatever it takes, Mr. President, whatever it costs, I will clean it up.
Plagued by unresolved procurement scandals over the years, Cabinet is now taking up the Social Health Insurance Fund, replacing it with 4 separate funds, including the Primary Healthcare Bill, the Digital Health Bill, Facility Improvement Fund Bill, and the Social Health Insurance Bill.
Once the bills are passed by the National Assembly, the county governments will then be expected to spearhead the implementation, a critical move which will see Kenyans required to be registered under the Social Health Insurance Fund. On the other hand, the health workers are now saying that they need to put the county government to task, as well as the Kenya Kwanza administration, urging them to walk the talk. Otherwise, there will not be a successful implementation of universal health coverage for the 4th time without a sufficient health task force. Olive.
Thank you, Helen, for that report. I'm curious, I have the COG Chair Committee Health on the line. What would you like to hear from him, speaking from a health reporter's perspective?